The qualities of the graduate nursing program are that you're studying with expert clinicians, going through case studies and seeing patients and documenting on those patients and thinking through the diagnostic process is a quality of our graduate nursing education at the nurse practitioner level. If you think about the doctor of nursing practice level, it's really more around policy and evidence and the translation of that evidence into practice. So building upon the science that already is there. And at the PhD level, I think it's very important that you're studying with scientists who actually have been successful and have been able to obtain, for example, NIH funding, which is the highest level gold standard funding in our discipline, and having exposure to scientists who really are passionate about the substance of what it is that guides our practice.
Depending on the topic we're learning, I take things pretty much every week that I learn in the classroom, and then I try to, use those in clinic. And it's been cool to then, when you come across certain diagnosis or certain physical exam findings and you're like, I just learned this in school.
All of our students are nurses first, so they know how to work with patients and they know how to critically think and they know how to apply that knowledge. But what we ask them to do is we ask them to take it one step further, to be the person responsible for making those decisions, of course within a team, but really fostering that learning and teaching them how to be independent practitioners and make safe decisions for the population.
I chose the University of Rhode Island because it's an outstanding program. URI is one of the few programs that will help pair you with a preceptor, which is pretty rare, and some really phenomenal teachers. Very easy, approachable, they know what they're doing.
The Sim Lab is a wonderful place. Our current Sim director really does an amazing job making sure that simulation practices are held to the highest standard of credentialing. Everything that's needed is provided to the students and also there to support the faculty. The facility itself has everything that we could possibly need.
What we bring to the table is years of experience in both the classroom and the clinical area. Our program has a very high pass rates, which is very important for our program, but also for the students, so that after they've spent all this time in didactic and clinical courses, they have to sit for a national board exam, and our pass rate is quite high.
It's just a great option for nurses who are looking to take the next step. Between facilities, the education, the knowledge, and the networking, the connections you're able to make here are just second to none.